Now I introduce Dr. Paul. I think in India, he needs very little introduction. He is the healthcare for everybody, including rare diseases. He has done so much for the rare disease population at ministry. So I request Dr. Paul present his talk. It is rare diseases, approaches to addressing the problem. Thank you. Take the podium, please.
Thank you, Dr. Amaya, and thank you so much for this opportunity. Distinguished speakers, distinguished participants of this meeting. It is a true privilege for me to be amongst you and to be able to share some thoughts as I perceive them, as I feel them, and I feel committed to. Just to let you know that I'm a pediatrician, neonatologist, was at the All India Institute of Medical Sciences, was also chairperson of the Department of Pediatrics for about a decade. So I have seen this problem from very, very close quarters. My division of genetics led by Dr. I.C. Verma and then later on by Dr. Kabra, we try to do our bit from the vantage point of an academic and of course, leading academic institution of the country. So I've been watching the developments in this regard. Much of the work done at AIIMS has been by the team members that I mentioned. But nonetheless, I have been very concerned about this important area. And my current responsibility within the Government of India at the NITI Aayog, which is the apex public policy think tank, chaired by the Honorable Prime Minister. I'm discharging responsibility to be helpful in facilitating policy buttons, pressing policy buttons in important areas, priority areas of our nation. Let me begin by setting the context from the macro picture, public health perspective. Large nation, huge population, huge priorities of health and nutrition spanning old diseases, the communicable diseases, the maternal and child health, reproductive health, adolescent health, and then diseases that are now making an onslaught on India, the non-communicable diseases. So when you look at the plethora of priorities, somehow, unwittingly, the focus on rare diseases falls through the stools. They are rare, but they are important. And from the individual family's point of view, this is their highest priority. And this human angle and human dimension cannot be and should not be ignored at all. But it brings in complexity on how we respond and how we apportion resources to a priority of this nature, which again is further complicated by the fact that it is not one disease or one set of diseases or one type of disease or a set of diseases with limited number of ways of addressing them. Some you need liver transplant. In the other one, you need a cutting edge enzyme replacement therapy. And in another one, it's about counseling. We don't also have ready diagnosis. So this is a complex area for public health of any nation, and more so for a country in transition as our nation is. If you look at the definition of rare disease from WHO, 65 in 100,000 people, pure numbers would be staggering for a nation like ours. I don't even want to venture into the number. It is a huge number, and when we look at that number, then it is rare diseases together do form an important cluster of healthcare problems and sad problems. There is also the helplessness dimension of the family as well as the providers when you are faced with a disease which a number of diseases or diseases that fall in the category of rare diseases. But let me now, highlight 4 areas for us to work on, 4 thematic areas that we would like to work on and which reflect the thinking of the government as of now. First and foremost, the best public health response is truly prevention if possible. Prevention, primary prevention, counseling for timely pregnancy, not delaying pregnancy beyond a certain age, screening whether the family has predilection for genetic disorders, and therefore look into how that risk could be minimized in a certain way. Not easy. Nonetheless, one must never forget that there is an area where many families can be helped. We need to promote timely pregnancy. We need to promote a quick screening of potential risk of genetic disorders by going through family history in a certain way. It can then be taken to the next level of prevention, the secondary prevention through prenatal screening, through prenatal diagnosis, if required, using chorionic villus biopsy, particularly useful for single gene disorders, followed by newborn screening to the extent that it can help. And yes, newborn screening is picking up in our nation. It is focused more on CAH and some other disorders, but certainly it is a way forward in its own right. And then, of course, there are ways of screening, which is targeted screening for LSD or severe combined immune deficiency and so on. And then it moves toward, shall we say, tertiary prevention by way of early diagnosis and treatment and better control to the extent that it is possible. And even when therapy may not be possible, our responsibility toward counseling the family and providing comfort and care to the child is critical. So this is a space to which we should always remain committed. If there is nothing else that we can offer, these are the areas which the medical profession and the public health teams should offer and should attempt to offer. The second pillar of our work is truly to strengthen the resources. This is from the Rare Disease Policy 2021, where there is a distinct effort on the part of the government to create centers of excellence and Nidan Kendras. Nidan is cure or taking care. So mix of facilities, mix of academic centers that are engaged in training, that engaged in laboratory workup, where a range of tests can be done to detect rare diseases. Also research, fundamental research in terms of laying out the landscape of the diseases that we have. We have an ICMR registry, Indian Council of Medical Research registry on rare diseases. So one major area of work that we are surely engaged in the area of creating the centers of excellence, nodes of excellence for training, for research, and for diagnosis in multiple centers across the country. So we have about 7 centers of excellence, another 7 or so Nidan Kendras connected together as a community of teams. They are typically located in medical colleges and our national laboratories. Very important from the point of view of creating the human resources for laboratory work and clinical counseling by the provider. So this is our second approach, and I would say significant emphasis on strengthening these sites and these academic centers, and look forward to suggestions on how to create bridges with these centers for centers of excellence across the world. Uh, I must say that the people who are part and parcel of these centers are very committed. They are passionate about the work around rare diseases. So you will be connecting with people who are really committed to take the agenda forward. And we want encouragement to be given to them so that we set up frontline laboratories, diagnostic laboratories, and people who will be able to do future research as well, and building on what they are able to do currently. The third pillar is, can the government of India provide financial resources to the families whose children have rare disease? Here, as I started in the beginning, the, the, the resources compete with other priorities. But what we have is the following, that up to 2 million rupees can be provided, I'm repeating, up to 2 million rupees can be provided through Rashtriya Arogya Nidhi, which is National Health Fund, so to say, which is provisioned at the Government of India level, at the central government, and is offered to people in need for expensive therapies within India and beyond India. It's open to all Indian citizens. So in that Rashtriya Arogya Nidhi, the National Health Fund, anchored at the Ministry of Health and Family Welfare, a one-time provision for providing 2 million rupees grant is possible. Now, in some sense, it is a huge money, but in the context of rare diseases, it is actually a relatively limited resource. However, this is enough, for example, to provide hematopoietic stem cell transplantation for the child. It's possible. It's possible with this much amount of money to have a liver transplant and surely to have kidney transplant. So in some sense, it opens a door for cure of conditions, potential cure of conditions, such as selected LSD, mucopolysaccharidosis type 1 in a timely manner, adrenoleukodystrophies, osteopetrosis, severe combined immune deficiency, chronic granulomatous disease, viscoelastic syndrome, and so on. So although on the face of it, it may not be very exciting compared to what some of the other nations are able to do, but as I said, this much amount of money can provide for a liver transplant. And we have a disease in an individual which is curable through that route, then it is taken care of. So stem cell stem cell therapy and transplant, liver transplant, for example, for GSD or MSUD or urea cycle disorder or tyrosinosis, it's possible. For renal disease, Fabry disease, or familial polycystic disease, again, renal transplant is possible. So this is one specific area where the Government of India has created a provision, a pathway for protection, financial protection, in the event of a very selected number of diseases. Now, on top of this, it is possible for us to seek support from state governments, and state governments are encouraged to take similar initiatives. Also, it is possible to reach out to philanthropy. Also possible as a part of the policy to go for crowdfunding for helping individuals. And also it is possible to build on this through corporate social responsibility related funds that are available with the industrial houses and businesses. So I would say in terms of providing direct support to the patients to take care of a disease, we have this option available as a part of the national policy. Just also like to mention here that we do not put price control over treatments that come by way of treatment of rare diseases or for the so-called orphan drugs. But I know it is modest, but it is a beginning. The fourth area of work is something which I would like us to work together in a significant way. And this comes from the fact that we are known as the pharmacy of the world, and we have a significant presence of our industry even in the areas, cutting edge areas of biological cures of the kind that the rare diseases may need. So we have potential for having biosimilars, potentially to be able to produce, manufacture enzymes, gene products, and so on and so forth. We have a promising industry in this area, and therefore it will be my request to use that resource available in our country for a global effort, because for rare disease research and development, what we do is actually global. It's beyond, because so little effort happen in this area, and it is so complex, because to do a trial, patients are a problem, optimum sample size is an issue, and so on and so forth. May that those issues perhaps have been discussed already. But the fact that I want to bring to your kind attention is that can we join hands to use the industry, presence of industry in several areas related to the treatments of rare diseases, several areas in the area of orphan diseases, where if you work systematically and use the might of our industry, who should be encouraged and facilitated to adapt to those products. We would like to create this as a win-win situation for the global community. And I like to hear your ideas on that, and we would see what opportunities exist, even to pursue 3 molecules, that's 1 molecule, if not 20. Also, in our country, we would facilitate clinical trials in this area. We have a network to create evidence, and if I go back to the starting point of my discussion, that in a large population, potentially, there are a large number of such patients for trial as well. And the fact remains that families of affected children and their relatives are quite keen to be enrolled as trial. We know that in this area, people want to join as trial volunteers. So I wonder whether to give a push, not only from the government of India, but should the global community be keen to work with us, work with my institution where I anchor health, to create pathways toward to developing solutions, finding solutions for rare diseases, and indeed bringing in those products that are developed elsewhere to Indian industry to make it more affordable. So you may have a product which is very, very unaffordable. It happens because of the unique nature of cures for the rare disease. But together we can attempt to use the base available within India, because our industry brings in affordability in a very significant way. We would be very keen to explore this area, to essentially make India a hub for cures of rare diseases, the present and the ones that are on the horizon, and the ones which are hidden in the garb of the future. And as I said, that it's possible, the national policy talks about creating a clinical trial network on rare diseases. In any case, it is very much within the realm of creating such networks, provided we join hands as a community of researchers and policy and solution enablers for the larger cause. I again would like to highlight the 3 points that I made, the 4 points, sorry, that I made. The 4 pillars of our approach are really to promote prevention, to build a techno-academic human resource base in the country through the centers of excellence, and then going beyond it. Thirdly, to create pathways for providing support to individual families to the extent that is within our realm today. And fourth, to help create India as a hub of R&D and product development and supplies of those products worldwide as a hub in India, building on what our industry has already achieved and the potential that some very eminent members of the industry community have going forward. I thank Ramaya ji for your constant encouragement for me to be a part of thinking community in this area. And I thank you all for the opportunity and patient listening. Jai Hind. Thank you.
Thank you, thank you, thank you, Dr. Paul, for your excellent, stimulating, encouraging presentation to all of us. I, being a scientist in discovery, your last part is really exciting to me. And we have been trying to work with the drug companies in India in the same line. You have mentioned very more often than twice the prevention, and that has been our mantra for a long time. 6 months ago, we did the webinar, just prevention of rare diseases, where Dr. Craig was one of the speakers and several others participated in it. And many of the things that you said are relevant, appropriate, and can be done if there is a commitment from everybody, including the government of India. I hope we will get there. And particularly, you have mentioned that strengthening our resources, having the Center for Excellences in Rare Diseases. And there are some other centers have already been started on their own. For example, LVPEI, LV Prasad Eye Institute, they started a Center for Excellence for Rare Eye Diseases. That's the first in the country as far as I know. And your commitment to the patients, some of the diseases are very expensive. There are some diseases really needs a penny. And these can be done with thought, just not hung up on the disease which costs a lot of money, but you can help a lot more people who needs medicines that are cheap and available. As you said, that India being the hub for pharmaceuticals, how come we are not making any drugs for rare diseases? There are 600 of them are there. Are they being exported or not being available in the country? I don't know. That is something that one should be looking into it. So in any case, sir, I'm grateful to you for taking your time and having this conversation with us, and hope we'll be able to work with you to get things where we want to go for the benefit of rare disease patients. Ultimately, what we want, rare disease patient should have the equal privileges like any normal, common disease patients. I hope we will be able to accomplish with your help. Thank you very much, sir, for your time. Appreciate it. Okay. I think now we have completed our speakers' presentations. Now I ask Mr. Sikri ji to give the vote of thanks and concluding remarks. Sikri ji.
Yeah, thank you, Professor Ramaya. I hope I'm audible. Everybody is able to listen to me.
Yes.
Yes, sir. Yes, sir.
Thank you. First of all, my greeting and gratitude to my friend, well-wisher Professor Ramaya, President and CEO of IORD, for organizing this wonderful event. All of you know that public health practitioners use a combination of disciplines like basic science and healthcare science, policy, etc. So Professor Ramaya heart beats only for the rare disease patient and for the orphan drugs. In nutshell, public health approach confines to rare applicability because of a few patients, that too in a scattered way. Orphan disease fails to attract less researchers and drug makers and scientists as well as policy makers because of less number. Painful version is that 90 million people in our country and 400 million people worldwide are affected because of this disease. Most rare diseases occur in childhood, which is more painful, particularly for the people who are taking care of such patients. Various speakers with their knowledge and experience have deliberated today, and they have set the ball rolling. It is the turn of the regulator, policymaker, government, drug maker, scientists, and medical fraternity to think about it. Few years back, unfortunately, there was no mention about rare disease or orphan drug in any of the policy. Thanks to Mr. J.P. Nadda, the former health minister, who is the president of Bharatiya Janata Party today, he took the initiative in the parliament and new health policy came and we could see this word. Although much progress was not made subsequent to that, but at least some beginning was there. So subsequently, some serious efforts have been taken very recently. I am really grateful to the Finance Minister of India. She, in her budget speech, kept her 6 pillars speech. The first and the foremost pillar was about the life science industry. And the last one was about the innovation, about the R&D. So I'm grateful to all the eminent speakers, distinguished panelists, respected delegates, particularly my thanks to Dr. Vinod K Paul for his valuable time and who is a full-time member of NITI Aayog. He is a genuine nationalist, a Rashtra Bhakt, whose heart beats for the nation. I would like to speak for a minute about what Dr. Paul has said. He was talking about the stem cell. He was talking about the liver transplant. He was talking about the urea cycle disorder. One very important subject he touched was about the price control. And more important he touched was about the CSR, corporate social responsibility. My humble submission on behalf of the entire IORD organization and on behalf of Professor Ramaiah and his team to Dr. Paul, sir, you are at a helm of affair, you are a policy maker, you have got the accessibility to the Prime Minister office also. Today, India has got a budget constraint because from 1% GDP, we came to 2% in this year, and there is a seriousness on the part of the government to bring further percentage increase also. But my humble submission is, the one immediate solution comes to my mind, which I didn't think in the beginning, but today I'm trying to add, CSR is a very, very important element as far as government and public at large is concerned. I'm the vice chairman of Haryana Government CSR Trust. I know the potential of this CSR. If the government can take the initiative, requesting the pharmaceutical segment, at least top 10 companies, that their CSR contribution, part of that can be contributed for the development and for the research and for the innovation and product development, what you touch, we can do wonders, because common manufacturer of pharmaceutical cannot afford to manufacture or develop this because of the viability. If government come forward and tell specific percentage that this much of percentage of CSR by pharmaceutical industry has to be contributed for this rare disease, we can do wonders overnight also. So that was the one area where I wanted to request you. And then some of the patients have given very constructive suggestion today, Dr. Ramaiah. In the chat box, if you go, you will be able to get very good ideas about they are talking about the import duty reduction. They are talking about some of the other discount and central government and state government support. They are talking about the insurance. So kindly make a note of that while making the representation to the government. Those points can also be taken into consideration. And I'm really happy that today the event went off successfully. I'll be failing in my duty if I do not mention IORD Managing Committee for their untiring effort. Dr. Krishnaji Rao and Mr. Sikdar for looking after logistics, and Rotary International District 3150 Hyderabad team under the dynamic leadership of District Governor K. Prabhakar and Rotarian Mr. P. Sambashiva Rao for their support, which deserves special thanks. I am also thankful to IPA, IDMA, BDMA, FOP, and other associations of pharmaceutical in India for their encouraging response in making this webinar a great success. On behalf of my great country, Bharat, to whom many people call it as India or some people call it Hindustan, I convey my gratefulness on behalf of 135 crore people of the citizens to Iran, France, Spain, Romania, Zimbabwe, Ghana, USA, Belgium, Canada, Bulgaria, and Switzerland. For any other country delegates, if they have joined, and I'll be for their unflinching loyalty for this genuine event today. At the end, I will say, Sarve Bhavantu Sukhina, Sarve Santu Niramya, which means entire universe should be happy. No one on this earth should be sick. All should have healthy life, happy life, and cheerful life. Jai Hind, Jai Bharat. Thank you.
Thank you, Sikriji. I think with this one, we conclude our webinar this time. I hope, I expect that in the future, we will be doing more of webinars, and you will join and encourage others to join and support the rare disease movement in India. Thank you very much. Goodbye.